We've talked a lot about uncertainty that's been activated since reform began, but the good news is that innovation has also taken a real active part in trying to develop new plans, new instruments, and new ways of delivering care. And we have Dr. Douglas Moeller here from McKesson, Medical Director at McKesson. And that's very encouraging that people are thinking outside the box and trying to find out solutions on how to deliver care more efficiently and in a better way.
That's exactly right. Last year we talked a little bit about molecular diagnostics and so forth, but we've realized since last year that some more systems thinking in terms of bringing information technology into the mainstream was really going to be an important step. And we've really been focused on some of what's in the press as well, especially around episodes of care.
Okay, can you define for us episodes of care? What are you referring to exactly?
We've had a lot of conversations, and my sense is that an episode of care that has a start date, an end date, included services, excluded services, included physician network, and included resources, is getting a lot of clarity about what's inside of an episode, especially for surgical and diagnostic portions of care. What's not so clear is how do we actually go to the next step of a bundled payment so that when we look at outcomes and so forth, that we can actually have aligned incentives that everybody that's part of an episode can understand exactly what their part is.
And also being able to deliver the right kind of care or test?
Well, clearly, the whole goal is that an effective care process so that we get clinical outcomes without complications is one of the primary goals. But aligning incentives so that everybody's in it together, potentially with a lump sum payment, is also the bundled portion of a care episode.
Do you have the right technology available to you to create these solutions?
I believe that we do, which is really a nice insight to have, that we've had parts of that in the healthcare environment for a time, and we're starting to understand that there are really four core competencies for making an episode work. The first one, where our focus of discussion is with health plans, is on claims performance, and that we can actually take claims from a variety of providers over a period of time and make sure that those are all aggregated correctly into an episode in real time. A lot of the models for episode of care are retrospective. They look at care that happened once upon a time.
Yes.
But if I'm an anesthesiologist and I did surgery yesterday on a knee replacement or whatever, I'm expecting to get paid, not wait 3 to 6 months for when the episode completes to get my payments.
And that's what generally happens now.
That's kind of how, if you don't think about it, it sounds like that's what's going to happen, that there's going to be a delay until the episode completes. The other piece that we've started to realize as we understand that we can do that kind of dynamically and pull this together at the back end, people start to ask, well, how do I know that an episode is even underway?
Right.
How did that occur?
Right.
And so a claims-triggered episode, which is that when the hospital or say the orthopedic surgeon for a knee replacement is sending in his claim, that's one way to recognize an episode. But there's other things that occurred before, diagnostic preparation and so forth, that you'd want to have be part of the episode. How do you capture that?
What is the mood of your audience this year versus what you were talking to people about last year?
Well, I think that as we've been talking with people about that front-end, back-end dynamic, they're starting to be more cautiously optimistic that there actually is a way to concurrently manage these episodes, and that health plans in particular that have a investment in healthcare strategies, health information strategies, actually are starting to see a real opportunity here for managing episodes, either on a lump sum payment, which is what you most commonly hear, or on a lump sum reconciliation, which is that they do their usual thing, and that when they work with an accountable care organization or wherever, that they can know at the end of that period for, say, 100 knee replacements, here's what it should have been, here's what the actual costs are, and you have a settle-up period.
Okay. Dr. Moeller, anything that I didn't ask? I think
the only
covered a lot.
part that I wanted to mention is that I talked about front end and back end. That's kind of the business axis. The part that's going to make this really successful is the clinical care management part, where we have opportunity for physicians and hospitals working together in this process to streamline care, to avoid preventable complications, and that total care management is going to be the best part of improving the process with analytics.
All right, Dr. Moeller, always a pleasure.
Thank you.
I'm Abel Jung. Thanks for watching.